Hello everyone, I am Jason Sims, and today we're going to be doing a super quick video on the drug Primaquine. Alright, before we can really talk about the drug Primaquine, we have to give some background information. So Primaquine, it is mainly used for malaria, and what causes malaria is the parasite Plasmodium. So some things to know about malaria: it specifically infects the liver cells, killing the cells, and then it travels from the liver cells to red blood cells, and similar thing happens. It kills the red blood cells. Now there are many different species of Plasmodium, and specifically the species of Plasmodium we're going to be talking about is Plasmodium alvale and Plasmodium vivax. Now the reason though we need this drug is because of those two species of Plasmodium that I talked about before, Plasmodium vivax and Plasmodium alvale. What is unique about them, about these two different species, is once the Plasmodium is within the liver cells, it can become something called latent, which basically means the parasite, it's still present, but it's just not showing active symptoms. It's just kind of staying hidden and dormant. Now what's bad about this is it can reactivate later on, years later, and then you'll have the malaria symptoms again. So the drug Primaquine basically will get rid of these latent forms of Plasmodium alvale and Plasmodium vivax. Now it won't really be handling the Plasmodium elsewhere in the body, so not really in the red blood cells or the bloodstream, but primarily going to be in the liver cells to get rid of that latent form. So we'll get more into this in a little bit. Now, this is a very unique concept that is probably very highly testable. So it's called radical cure, and I've only seen this right now associated with malaria with Primaquine. And basically what a radical cure is, it is getting rid of the latent forms of malaria, of the parasite. Okay, so before someone is given Primaquine, there are some considerations that have to be known. It has to be known if the patient has G6PD deficiency. Okay, what this stands for is glucose 6-phosphate dehydrogenase deficiency. Okay, I don't want to say that again because it's a mouthful. And basically what this disease is, it causes the body to not have the enzyme G6PD, which, comes from the name of the disease. And by not having this enzyme, the body is not able to get rid of something called reactive oxygen species. And if you ever heard of antioxidants, antioxidants get rid of this, the reactive oxygen species, also called ROS. So basically, G6PD will be acting as an antioxidant in some kind of way. Now, with G6PD deficiency, that is going to be an absolute contraindication, but we're going to be talking about that more in a little bit. Okay, now we have another disease called NADH, methemoglobin reductase deficiency. And I know that's even a longer mouthful. Now, that disease, it's not going to be a contraindication for this drug Primaquine, but it will be something that should be monitored closely. Specifically, what the Plasmodium does, it's going to increase the levels of methemoglobin in the blood, and we call this methemoglobinemia. And why this is bad is because if there's more methemoglobin, there is going to be less oxygen carrying ability by the red blood cells. So these patients who have this disease will often have bluer nails, bluer mucosa, like in the mouth and other areas, because they're getting less oxygen. So they're getting harder to bring the oxygen to the rest of the body. So again, that's not a contraindication, just something that we want to be monitoring during prescribing Primaquine. So Primaquine does have some adverse side effects, but they're very minimum in amount that there are actually, shockingly for this. So you're going to have the normal side effects like GI symptoms, but pretty much every drug has that. But the main one that we want to be talking about is something called QT interval prolongation. And to just be very simple with this, what we need to know is that you have to get an EKG to make sure the patient doesn't already have a QT prolonged interval, and something to know that this drug can also further increase it. Okay, so those were adverse and side effects, which are not contraindications, so you can still be just monitoring that. Now, contraindications, it's very strongly that you don't want to be giving this medication if the patient has whatever the contraindication is. So we already talked about G6PD deficiency, so that's going to be an absolute contraindication, and the reason why this is a contraindication is because it can cause something called hemolytic anemia. So as I said before, the Plasmodium, the parasite, will be killing the red blood cells. Now, people who already have G6PD deficiency will also be having more destruction of their red blood cells because they are missing that enzyme which acts as an antioxidant. So the combination of the G6PD deficiency causing red blood cell destruction and the Plasmodium causing red blood cell destruction, it's not going to be good. So that's why it's a contraindication. Now, the next contraindication that's very important to mention is if the patient is pregnant. So you're going to want to get a pregnancy test, UCG or ACG. So the reason why you want to do this is a similar reason as before. We want to make sure the fetus does not have G6PD deficiency. And this would be bad because as we would have hemolytic anemia, as I said before, we would have fetal hemolytic anemia. Okay, so before we can start dosing of Primaquine for a patient, what is Primaquine for? It's going to be for the latent inactive Plasmodium, the parasite within the liver cells. So it's not going to really be mainly used for the red blood cells or in the bloodstream form of malaria. It's just going to be for that latent inactive form of malaria within the liver cells. So for this reason, we're going to want to start giving a patient a different anti-malaria drug that would be sensitive, that would be effective for this malarial form. Now the whole idea, again, it's called radical cure. And basically what this is doing, this idea of radical cure is just eliminating the Plasmodium within the liver cells. Now, if we don't get rid of the Plasmodium in the liver cells, the malaria can come back a year later as a relapse, a reoccurrence of the malarial symptoms. So let's say now you're going to be traveling to an area that is known to have P. ovale or P. vivax species. And, not any other anti-malaria drug is going to be effective as a prophylaxis for this reason. Okay, so what are we going to do? So at this point, you can give Primaquine for a prophylaxis, and you're going to want to be starting this 1 to 2 days before the exposure, before you get there, and you're going to want to be continuing this 7 days after you leave, after the exposure, and that's for prophylaxis. Now, as we talked before about the treatment with Primaquine, it's going to be given for 14 days, and it's going to be a similar dose as the prophylaxis, but also it's important to know that you give this again with another anti-malarial drug that gets rid of the bloodstream and the red blood cell form of malaria, because this one is only going to be working in the liver cells for the latent forms. Okay, so let's talk about the mechanism of action for Primaquine. So it's a little bit shaky and unknown for science right now and medicine right now of how this drug actually works. The current idea of an UpToDate in the databases that I found is that Primaquine acts as a reactive oxygen species, a ROS. And basically by this, it's damaging DNA and damaging other components of the Plasmodium and inhibiting it for doing more DNA replication. All right, so I hope I made this a nice and quick video and easy to comprehend. I hope you enjoyed. Please like this video, please subscribe, please share this video. I'm gonna do my best to continue to make these short educational videos. See you in the next time.